everybody. My name is Ryan at 3X Clinic here in Berkeley. Today I'm going to show you how we do lunges to help balance the hip rotations and help to reduce the chronic pain of the lower back. Lunges are one of the key exercises that I show people to balance the hips. Some of the tendencies of the hips is for one side to hike up higher than the other, and also for one side to rotate forward more than the other. People have this chronic pattern that I've seen, they'll have it for many, many years. And with massage, we can reduce that rotation, but with time, it always comes back. Some of the causes of these hip rotations could be from birth trauma, because what we see when we work with people earlier in life is a lot of times they have this hip rotation very, very early in life. We can help to reduce it through chiropractic adjusting, through massages, and things like that. But what we see, if you really look closely at the muscles of the hips in the back and in the front, is that the strength on one side will be much greater than the other side. For a lot of people, this is their right side, because also another thing that builds these imbalances is leaning on one side like this when they stand for most of their life. A lot of people have what I call a post leg, meaning whenever they're standing, their weight is not balanced sort of in the center of their feet like this, where the center of my gravity is coming down between my feet. Usually their hips will drift to the side, and now all the weight's coming down through this hip. And even worse, their feet will be closer and then over here. And look how far my center of gravity is off from being in the middle of my feet. Some of the other things that we see that we look for in terms of personal training, yoga instruction, and physical therapy is what's called lower cross syndrome. And that means the thighs, the quadriceps, these muscles in the front of your legs are much stronger than the hamstrings that come down the back. And what makes this pattern even more out of balance is that the glute max, the gluteus maximus, will tend to not engage as much as it should. This is why when you're taking a class with a personal trainer or a yoga instructor, they're always calling out for you to squeeze your glutes. It's because we have to really train those muscles to engage. And what causes the hip rotations, and for one side to hike up higher than the other, is that a lot of times this pattern gets worse because one glute, a lot of times that's the right side, is stronger than the other glute. And so we'll see the right glute weaker than the left. The right glute is stronger than the left, and that'll make that left hip sort of drop down a little bit because it's not being well supported. A lot of times that will be the side where the nerve pain comes down that side. But it can go on either side. It just depends on which vertebrae is causing the nerve impingement that's going down the leg. Okay, so now let's get into how to do these lunges in a very specific way to help to minimize that pattern. What we're going to do is to get into a right lunge first. For a lot of people, this will be their stronger side. And we want to avoid just using the quad to do the lunge. If you do your lunges this high, all that we're building is the quads. And remember that part of the pattern that throws people out of balance, called lower cross syndrome, is that the quadriceps are already stronger than the hamstrings on the bottom and in the back. So we need to get past that point to 90 degrees. Now, for a lot of people, the glutes and the hamstrings are already too weak to relax here. And so what happens is this hip will rotate out that way. That's avoiding the opening of the hip flexor. So if your right leg is forward, that left hip needs to rotate way forward like that. Now I'm locked in the straight angle of the hip. Now my right leg, I'm going to deepen the bending of the knee. We want to try to get to 90 degrees there. Now the tension of the psoas in the front will make people's hips go like that. So after you bend in the knee, you need to press the hips forward, and look how I'm lifting in the front of the hip. That comes from an engagement in that back glute. So first bending into the knee, lifting in the front of the pelvis and pressing the pelvis forward. That should make you feel it strong down that quads in the back. And then we want to try to straighten that knee as much as we can. Run through those 4 steps again. First, this hip is going to rotate out. So we want to push that hip forward so that the hips are facing directly forward. And then we bend in that front knee. That will make the hips slide back. So we need to rock the hips forward and lift in the front of the pelvis. So you're going from that to lifting up to there. And then we try to push that back knee as straight as we can. This knee's had a lot of injury, so that's as straight as my knee's going to go. Again, rotate that pelvis forward, bend in the front knee, lift the front of the hip, push that back knee back. Now, if you cannot stay here, put 2 chairs on either, 1 chair on this side, 1 chair on your right side, and use that chair to hold your weight here. Once you're here, now I'm squeezing my feet towards each other. So I'm compressing those feet towards each other to help to really engage that hamstring and the front of the quads there. Now, if you're holding chairs, you're going to use that support to slowly touch that back knee down. If you don't need a chair, you can interlace your fingers and just reach up. Once you reach above the head, you'll see this happening. We don't want that. That means your core is let go. You got to pull those ribs in while you reach up. Now we're going to slowly go down and touch that back knee and just come up to where that front knee is at 90 degrees. Slowly come down and touch and straighten until that front knee is at 90 degrees. We're going to do one more and come up, and then we're going to do the other side. Okay, now I'm going to switch sides so you can see me. I'm stepping my left leg forward. And again, for a lot of people, that left glute, the glute max on that left, a lot of the times is weaker than the right side. So this might feel like the weaker side for you. If that's the case, you want to take a little extra care to strengthen that left hip so that it comes in balance with your right. And the point of strengthening the left hip to come in balance with your right is so that you can use better biomechanics when you stand, when you walk, and when you run. Okay, now I'm in a left lunge. My left leg's forward, my right leg is back. Now you'll feel that the hips want to rotate like that. Push that right hip forward till it's facing directly forward. Now we're going to bend into the front knee, lift the front of the pelvis. You see that? I'm going from here to lifting here. That's a pulling in of the lower abs and squeezing of that back glute. And then we're going to push that back knee as straight as we can. Now bend more into that front knee, hips face forward, lift in the front of the pelvis, push the back leg a little more straight. Again, it might help you to have a chair under each hand to help you support your body weight here. We're still in the quadriceps until this front knee is at 90 degrees. We want to strengthen the bottom, that's the hamstring, and the glutes. So you might need to slide your back leg further back, deeper on the front knee. I'm going to lift my arms so you can see my hips. Press the hips forward, lift on the front of the pelvis, push that back leg straight as you can. Now squeeze your feet towards each other. They're not moving, but I'm pressing that foot in this way. This foot is pressing this way to create that pressure of squeezing in. I'm going to lift my hands so you can see as you lift, you don't want to do this. You want to pull it in like that. Now slowly let that back knee touch and just come that high. Slowly come down to touch and just up to there. And slowly down to touch and up to there. This is how I teach people to do lunges when they need to balance their hips. I do massage therapy for pain management. I'm also a yoga instructor and a personal trainer. I just finished my doctorate of chiropractic. People come to me all the time for these mysterious hip pains. And when I say mysterious, is that they've already been to an MD. The MD will x-ray it and they'll say, your hip looks fine. You have no problems. But yet they have a chronic hip pain that never seems to go away. A lot of the time, that's because the strength is greater on the right than it is on the left. What makes that worse is the strength on the front is much more than it is in the back. And the hamstrings are doing the work rather than the glutes. So if you run for recreation, a lot of times this is why runners will tear the hamstring and they tear it right at the top of the hamstring there. That's because the glute's not doing the work that it's supposed to do when the foot hits the floor and then pushes back. That should be the glute. But if the glute's not engaging, the hamstring's going to engage, which will lead to a tear in that area. Now, if those lunges are very easy for you, you can put weights in your hands. And then as you get forward here, you're down here, you go down and you can do a curl as you come up. Another thing that I like to do is get the weights overhead and pull them down and push up like that with the weights. So again, I'm going to run through those one more time at this different angle so you can see. Step forward, go into a deep lunge, bend the front knee, rotate that hip forward. Now I'm sliding my hips forward. I'm lifting the front of my pubic bone and then straighten the back knee as much as you can. Deeper to the front knee, rotate the hips forward, lift in the pubic bone, and then straighten the back knee. Once you've got that tight, try to hold it as an isometric, squeeze your legs towards each other, and then slowly start to bring that knee down. Remember, you're pressing through the ball of the foot on this front foot. You don't want the weight on the outside of the ankle, letting that knee fan out to the sides. Your knee should be right over your ankle. Now slowly down, touch, and come up. You want about 75% of the weight on that front leg because the leg that's coming back there, on this leg that's coming back, your femur is coming down this way, your tibia is coming up, and it's almost as if these bones meet end to end, and you don't want a shearing pressure pushing through your knee like that. So this front leg should be doing the majority of the work. I think of it like 75%, 25%. I'm going to run through on this left leg so you can see one more time clearly at this angle. First, as we get into lunge, you got to deepen it, rotate that hip forward. My left leg is forward here, so my right hip's going to want to drag back like that. Got to rotate all the way forward like that. Pull the abs in, lower abs tight. Bend deeper to the front knee. The pelvis sort of rocks forward and lifts in the front, and then straighten the back knee. Run through those steps a couple of times. Bend the front knee, lift in the front of the pelvis, straighten the back knee. Once you have that tight, you can put weights in your hands if this is easy. If this is so hard, just bring chairs up on either side and rest your hands on chairs like that. And then slowly come down and touch, and slowly come up just to that point. You should feel it in your glutes and in that hamstring there. Your quads are going to work too. If you're saying, I feel it in my quads, yeah, you're building your quads still. This is your quadricep. But the goal is to get low enough where you feel it in the front of the hip here, in the back of the hip and the hamstring, nice and slow in touch. If you have weights in your hands, you can pull in here. If your arms are free, you can just stretch up and touch. Okay, that's how I teach the lunges. Very powerful exercise for people that have chronic lower back pain. You want to go slow and stay low. That's what's going to help you the very most. Try to build up the strength in the left to balance up with the right, or if that's not your situation, find out which hip is weaker, because one of them are if you have chronic lower back pain. And that will make the chiropractic adjustments and the massage do so much more benefit for you. If you're getting therapy like this, you want to be able to do exercises on your own that will help you to maintain those results in between the sessions. Okay, again, I'm Ryan at 3X Clinic. Thank you so much for watching, and I hope you have a great day. If you have any comments or any corrections that you'd like to add, that's what the comment box is for. If I made any mistakes, please let me know, and I'd be happy to make another video to clear those things up. Thank you for watching and have a great day.